Okay, this is my IV piggyback and push competency. The first thing we're going to want to do is check our MAR and the doctor's order and make sure that it matches. Then we're going to want to make sure we have the correct patient, we have the right medication, we have the right dose, amount of medication, the time, and the route. And after that, we're going to check for allergies, make sure the patient's not allergic to anything we've got that we're going to give. Then we're going to get the medication. We're going to compare it to the MAR, make sure that matches and is correct. And we have Zantac at 50 milligrams. We're going to want to make sure that the patient has adequate renal function and that we're going to watch for constipation and diarrhea. Then we're doing Lanoxin, which is digoxin. We're going to do 0.5 milliliters. And we're going to want to check the apical pulse for 1 minute and make sure that the heart rate is above 60 and make sure it stays in the therapeutic range. Okay, after we've done all that, we've compared our medicines, we're going to wash our hands, and we're going to gather our equipment. Okay, I'm going to go ahead and I'm going to draw up my Lanoxin using a filter needle. I'm going to do 0.5 milliliters. Make sure there's no air bubbles. Okay, we're going to scoop this back up. Okay, we're going to make sure that we label our syringe. Okay, then we're going to prime our tubing for our Zantac, 50 milligrams. And we're going to make sure that all this is diluted correctly. We have the rate of administration. And all fluids are compatible. And we're not going to want to touch the inside or the same to keep from contaminating. Make sure that this is clean so we don't waste it. To prime our tubing, make sure there's no more air bubbles in it. Okay, we primed our tubing. We didn't touch the sharps container to prevent contamination. We've got our meds done and they're labeled and everything is safe and compatible and it all matches. Okay. We're going to go to our patient's room and we're going to want to explain the procedure, make sure that we have the correct patient, and we do 2 patient identifiers using name, date of birth, and we're going to compare it to the MAR to make sure everything matches. Then we're going to wash our hands, put on some gloves. We're also going to ask the patient again if they have any allergies or if they're allergic to any of the meds that we're going to give them. We're going to start with, well, first off, we're going to check the IV site to make sure that it still pattens, it's not swollen, there's no infiltration, and it's still running. We're going to bring our primary bag below it to look for blood return. And we're going to do the push first, and although it is compatible, we're going to want to clamp behind here. We're going to do it at the port closest to the IV site. We've got our alcohol wipes and we're going to clean it. Okay, and this is 0.5 milliliters and we're going to give it over 5 minutes. So we're going to do 0.1 milliliter over 1 minute. Okay, we did the 0.1 milliliter over 1 minute, and for the next 4, we would do 4 milliliters, 0.4 milliliters, we would do them over 1 minute each also. After we're done with that, we'll put it in the sharps container, and we would assess the site, make sure that it, no adverse reaction to the medicine we gave. The site is not swollen, it's not infiltrated, and it's still flowing appropriately. Okay, then we're gonna go for the piggyback. And we're gonna put it on the port closest to the primary bag. We're lower the primary bag. We're gonna get our alcohol wipe and we're gonna clean the port closest to the primary bag. Okay. We've made sure that there's no air bubbles in any of the lines. We're gonna make sure that this is the one that we control it with, and this one is open. We're going to control the piggyback flow rate with the primary clamp. We're going to do 25 drops a minute, so we're going to do around 6 every 15 seconds, and then we're going to count for a full minute and make sure it's 25 drops per minute. Okay, now we have our piggyback of Zantac flowing at 25 drops a minute. If we were doing a pump, it would be at 150 milliliters an hour. Okay, once the piggyback finishes, we're gonna make sure that this one is clamped, so if there's any excess, it won't go everywhere. And we will undo it from the primary line, and we will go ahead and trash this. We're going to put the primary bag back up top, and then we're going to reset the drop factor or the rate to whatever the doctor or the pre-order was, whatever it was at the beginning of the order. Okay, and so that is set. You should have everything done, and you want to check your patient, make sure that they have not had an adverse reaction of any kind. The IV site is not red, it's not swollen, it has not infiltrated or anything, and it is still flowing appropriately. Alright, then you just document.